The next letter.
The yellowish eyes.
Yellowish eyes is what? It should be jaundice. What is jaundice? It is? And how many types of jaundice do we know? Ask your question. You are asking the question to yourself. Poor uterine contraction of the uterus can lead to what? Uterine contraction of the uterus can lead to what? Can lead to? It can lead to postpartum hemorrhage. Poor uterine contraction, it can lead to. First of all, look there if there is postpartum hemorrhage. Is there? Are you seeing how the answers are coming? Now, according to you, what is postpartum hemorrhage? Yes, madam.
Postpartum hemorrhage is a condition in which a woman loses 500 mils of blood when she has put to birth vaginally and CS 1000 when put blood through
Good. Are you getting what she said? Because in the theater, when a woman lost blood more than 1000 cc, 1000 mils, we term it postpartum hemorrhage. Then in the maternity, when it is above 500, we term again postpartum hemorrhage. Now, postpartum hemorrhage can be divided into primary and. So, what is primary postpartum hemorrhage? What is primary postpartum hemorrhage?
So, bleeding is when the person is 4 hours.
It is?
Bleeding after the first is 4 hours.
It's bleeding that occurs within 24 hours. And then, secondary postpartum hemorrhage. Secondary postpartum hemorrhage. What is secondary postpartum hemorrhage? Secondary postpartum hemorrhage is a type of hemorrhage that takes place within 24 hours to 6 weeks. It is secondary. Are we there? That is secondary. But now, if they ask you in nursing sciences, one, what is primary hemorrhage? Two, secondary hemorrhage. Three, tertiary hemorrhage. And four, reactionary hemorrhage. What is primary hemorrhage? It is within 24 hours. Then primary hemorrhage, secondary hemorrhage, and 6, tertiary hemorrhage. It is hemorrhage that occurs after 6 weeks of delivery. It is tertiary. Then reactionary hemorrhage is which type? What What is reactionary hemorrhage? What's reactionary hemorrhage? Reactionary hemorrhage is bleeding that takes place within 24 hours, and this bleeding is being seen within 4 to 6 hours after injury. It takes place within 24 hours. In these 24 hours, you see the bleeding, it is between 4 to 6 hours. Are we there? Is it understood? I'm saying that reactionary, it is a type of bleeding that takes place in 24 hours. In that 24 hours, you are going to see bleeding within 4 to 6 hours. In that 24 hours, around the 4th and the 6th hours, you will see it bleeding. We call it reactionary. Is that clear? Are you there?
Yes.
You are there? Yes? I'm saying that reactionary hemorrhage is a type of hemorrhage that takes place in 24 hours. In that 24 hours, between the 4th and the 6th hours, you see bleeding. Is that clear?
So that every 4.
So is it constantly like?
You see from 4th hour to 6th hour.
Yes, from the 4th, it can be 4th, 5th, 6th. You see bleeding. In 24 hours, within 24 hours, particularly between 4 to 6 hours, you see bleeding. We call it reactionary hemorrhage. Is that clear? Sir, hello? Is that clear? Are we there? Now, if they ask you to differentiate between blood that is coming out from an artery and blood that is coming out from a vein and blood that is coming out from a capillary, how can you differentiate? How can you differentiate an arterial blood, venous blood, and capillary blood? First, the color. What's the color of arterial blood? What is the color of arterial blood? What is the color? The color of an arterial blood is bright red. The color for a venous blood is dark. Are we there? It is dark red. Forget. Color for arterial blood is bright red because it contains oxygen. Color for venous blood is dark red because it does not contain enough oxygen. Because I can ask you to differentiate in terms of color, you should be able to differentiate. Capillary blood, it is a red or pink. Now, how does the spit look like? This type of blood. What is the spit for arterial blood? It is rapid and difficult to control. For venous blood, it is steady and it is oozing out. It is steady and oozing. This is oozing. It is steady and oozing. While for capillary, it is slow and oozing. Oozing, the way it is just coming out tight. When you talk of steady, you see how something is pumping, but you see it is just oozing out, just coming out in a type of way. That's what we call oozing. For venous blood, it is steady and oozing, but for capillary blood, it is slow and oozing. Good. Let's go to the next question, please. Repeat the question. Have we even given the answer to that question?
Yes, sir.
How was it?
Those particular
They were talking on what?
War uterine contraction following delivery of the placenta can lead
Okay,
to
now we are not talking about placenta. Good. What is placenta abrosio and what is placenta previa? Now we are entering into the root of the matter gradually. We discover that now this can also help you to answer mother and child. So what is placenta previa? What is placenta previa? When the placenta partially or totally covers the cervical os, we call it placenta previa. When the placenta partially or totally covers the cervical os, we call it placenta previa. Are we there? Now, I hope you are there. All of us are at the same speed. When it is partially or totally covers the cervical os. And this cervical os should be internal cervical os. Because we only have external cervical os. So we are saying placenta previa is when the placenta partially or totally covers the internal cervical os. The next question, how can we assess or diagnose placenta previa in the maternity? It is? That's good. There is bleeding, but it is painless. Now, if they ask you in multiple choice, this bleeding comes around how many months? So when a woman starts having painless vaginal bleeding around the 7th month of gestation, it is placenta previa.
Meaning that it cannot occur in less than if 7 months are not.
No, when we talk like that, we discover that like we always take the majority or the time that it easily occurs. It does not mean that it cannot occur before 7 months, but we discover that around the 7 months you can easily have it. Is that clear? Now, we can even do ultrasound to discover it, right? The next, if they ask you how can we treat it, how can we treat placenta previa? Hmm? The very first thing is how you are talking of CS, they accept with you. But how can you do CS that you have not hospitalized the patient? Are we getting? You cannot do CS that you have not hospitalized. So the first should be hospitalization. The second. The second should be when you hospitalize this patient, you check for fetal maturity. And if you discover that there is no fetal maturity, what are you going to do? You give what? You give corticosteroid like beta-metazole, which is going to help to mature the lungs of the baby. Yes, that's good. At this time, no vaginal examination again. We equally have what we call placenta abruptio. What is placenta abruptio? Yes, when the placenta prematurely detached from the decidual basilis, we term it placenta abruptio. A placenta abruptio. So if they ask you to differentiate between placenta abruptio and placenta previa, you should be able to explain. For placenta previa, we say that the bleeding, the vaginal bleeding is painless, but for placenta abruptio, it is painful. I have a lot of cramps. Good. Yes. So it was placenta, it was hemorrhage. It was hemorrhage. For that question, it was what?
Placenta previa.
Okay, we have defined placenta previa, right?
Yes, sir.
B was what?
Ectopic pregnancy.
So what is ectopic pregnancy? Out of the uterus. For example, if this is a uterus, something like this. So we are saying that if implantation takes place any place out of the uterus, then in ectopic pregnancy. But research shows that most of ectopic pregnancy takes place in the fallopian tube. And the tube, or another name for fallopian tube is what? What's another name for fallopian tube? We call it the ovidum. So we are saying for ectopic pregnancy is when implantation takes place out of the uterus. And it is mostly seen that it mostly take place in the fallopian tube. For example, this is how it is, something like this. Good. So maybe these are the tubes. Normally it was supposed to take place in the uterus here, but if it takes place out of the uterus, we term it ectopic pregnancy. Now, ectopic pregnancy is a pathology of which half of pregnancy? Ectopic pregnancy is a pathology of which half of pregnancy? No, we'll talk of half, the first half and the second half. The first half made up of have is the first trimester, which is first to 3 months. First to 3 months is the first trimester. Then from 4 and above is the second trimester. So I'm asking, ectopic pregnancy is a pathology of which half of pregnancy? It should be the first half of pregnancy. Now, if they ask you to give another pathology of the first half of pregnancy, is what? Then you know.
Abortion. Abortion.
What is abortion?
Abortion is when
Is abortion a pathology?
abortion can be threatening.
Is abortion a pathology?
So I had a kid from
High. That's good. What is high density form? It is?
so it's more
It is a molar pregnancy. What is high density form?
It's a condition in which instead of the fertilized growing the food accumulation.
Write it down. Do for the minute. And how can we assess ectopic pregnancy? The person will suffer from severe abdominal pain. Because most of the pathologies that are given here are the pathology of the first half of pregnancy. The next is what?
The next is postpartum hemorrhage.
We have discussed on that, right?
Yes, sir.
Next.
Puerperal sepsis.
What is puerperal sepsis? What is puerperal sepsis? What is puerperal sepsis?
So, a temperature of 8 degrees Celsius after delivery.
So, a temperature of 38 degrees after surgery. Good. The problem is, puerperal sepsis is simply an infection to the genital tract. It's an infection to the genital tract. Now you are talking of 38 degrees because Hippocrates, the modern, the founder of modern medicine, he is saying that an increase in temperature is a beneficial sign to tell you that there is a presence of an infection. So that's why I'm telling you that puerperal sepsis is a genital tract infection that occur at any time between rupture of membrane or labor. Infection of the genital tract occurring at any time between rupture of membrane or labor. Good. The next.
Number 4. When managing a hypertensive client, what advice should you give him or her?
Good. First of all, what is hypertension? What is hypertension? Do we know the normal ranges of hypertension, of blood pressure? Do we know? If you know, good. What's hypertension? These people don't know the normal values. Yes?
So it's an increase in blood pressure with it's an increase in blood pressure with a systolic pressure of above 90 and there's above 130 and a diastolic pressure of above 90.
Above 90 because look, if we talk of 90 to 129 all over 80, 60 to 89. This is the normal blood pressure. But if you have 130 to or and above to 139, all over 60 again to 89. This is pre-hypertension. This is pre-hypertension. Now when we talk now of hypertension, we have now 140 on 90 degrees. This is hypertension. Are we getting? Now, how does hypertension comes about? Hypertension comes about when factors like you have been stressed up, you take too much of salt, all of those. When you have been stressed up, too much of salt is going to work on the sympathetic nervous system. It's going to contract the sympathetic nervous system, or it stimulates the sympathetic nervous system to produce what we call endogenous catecholamines like adrenaline. Adrenaline that will come and contract the sympathetic nervous system in such a way that if normally this is how the sympathetic nervous system was supposed to be, like this, but as a result of the release of adrenaline, adrenaline will come down and narrow the blood vessel. When this blood vessel is being narrow, you discover that blood cannot pass easily, but it can pass easily here. Since blood cannot pass easily, it creates a pressure which we call now blood pressure. Are we there? So, what are some of the things that can cause blood pressure? We say stress, increased salt intake, what again? Obesity, atherosclerosis. What's atherosclerosis? Fat deposit at the level of the vessels called atherosclerosis. Now read the question that they are asking. At least we have a brief knowledge until now.
When managing a hypertensive client, what advice should you give him or her?
So what can you give before looking at the patient? Decrease the level of salt, ask the patient to do sport, things like that. So read A and let's see.
Increase salt intake.
Is it correct? Is it correct? Let's go. Because if the patient takes increase of this salt, you worsen the situation. I'm saying that salt, when you take salt, salt is going to stimulate the sympathetic nervous system. When salt stimulates the sympathetic nervous system, it's going to produce adrenaline. Adrenaline that will come and constrict your blood vessel in such a way that for blood to pass through, it takes a lot of pressure and difficulties. And this pressure is what we call blood pressure. It's going to increase. So when somebody is hypertensive, please reduce the way you're giving salt. Putting salt in this for her food.
The increased intake of saturated fats.
What are saturated fats? No, that is biochemistry. What are saturated fats? And what are unsaturated fats? What are saturated fats? These people also have a problem in biochemistry. Yes, people have a problem in biochemistry. Saturated fat, we discover that the chain is linear unsaturated fat, the chain is not linear. The carbon chain is not linear. And you discover that for unsaturated, you discover that the carbon are almost on opposite sides. But for saturated, the carbon is on one side. Let's allow our chemistry. People say we start aching for nothing. Let's concentrate. Yes? Breathe.
Decrease salt intake.
Yes? What do you mean?
Decrease intake of vegetables.
So the answer should be decrease salt intake. Instead, if you are hypertensive, you should take more vegetables. So the answer is decrease salt intake. I hope all of us know why. Let's go.
Number 5. Which one is a complication of severe malaria?
Which one is a complication of severe malaria? We know that for somebody that is having malaria, when we pipette for somebody is suffering from malaria, somebody is, that's good. What are you touching like that? The spleen. You are touching the spleen because the spleen has what we call blood plus malaria. The causative agent of malaria is plasmodium, and plasmodium feed on blood. It is called that the spleen has a lot of blood. That's where the plasmodium will go and feed on it. When it feeds on it, it will enlarge the spleen. When the spleen is being enlarged, it touches it is painful. So how many types of plasmodium? Can we name the type of plasmodium, please? Falciparum, vivax, ovale, malaria, and noesi. 5 of them. So now, we have already seen that since the plasmodium is going to feed on blood, what can be the complication? It can cause you to be anemic, right? What can be another complication of malaria? It can be dehydrated. But you discover that the most complication of malaria is anemia. Let's see.
Hypertension. A.
Never.
B. Typhoid.
Never.
C. Anorexia.
And what is anorexia? Loss of appetite.
D. Anemia.
Yes. Loss of appetite is a secondary cause. It is also a sign and symptom of malaria. But the most complicated, the complication of malaria is anemia. So what is anemia? It is a decrease in hemoglobin level. We call it anemia. There's a question that came in case study 2018. They were asking you what is pernicious anemia. Look at that question.
It's a deficit in vitamin B12.
It is a deficit in vitamin B12. What causes it? Lack of intrinsic factor. This intrinsic factor is found where? Where is the intrinsic factor found? It is found at the parental cells at the level of the stomach. You discover that these intrinsic factors are unable to absorb vitamin B12, exposing the patient to pernicious anemia. Good. Next question. If we are okay with that.
One risk factor associated with hypertension is?
One risk factor. What can be the risk factor of hypertension? I'm not getting. What can be a risk factor of hypertension? Genetics. Now when they talk of a risk factor, a risk factor, when we talk of genetics, we can talk of family history. Are we there? Accept the truth. Family history means if you are from a family that hypertension is in that line, you have been exposed to hypertension. Accept the truth. What's another risk factor? Increased salt intake is a risk factor. Obesity is a risk factor. Are we there? Read the question, read the answers, and let's go.
Are they talking about the risk factors when you have hypertension or before you have hypertension?
Now, when they talk of risk factors, something that can expose you to have hypertension. Are we there? Something that can expose you to have hypertension. Like, for example, we talk of family history. If in your family there are people there, you can easily have it. If you are obesity, you can easily have it, because if you are obese, you have too much fat. Even age is a risk factor, because if you look as you are aging, you have the tendency to be hypertensive. Are we there? So let's see if
A. High vegetable intake.
no.
B. High salt intake.
High salt intake is a risk factor. Read again.
C. Exercise. D. Decreased alcohol intake.
Are you see? So the answer is
D.
increase
Salt.
is a risk factor. Explain why.
Number 7. Hysterectomy is.
What is hysterectomy? It is because hysterectomy can be partial and it can be total. So when they talk of partial hysterectomy, it means maybe you are removing just the uterus. Now when they talk of total hysterectomy, you are removing all of the reproductive system. It means you remove the uterus, you remove the ovaries, all for a total hysterectomy.
A. Surgical removal of the fallopian tube.
No, surgical removal of the fallopian tube, call it what? It is appendectomy. That's good. What again?
Surgical removal of the uterus.
Surgical removal of the uterus is? It is hysterectomy. See,
Surgical removal of hymen.
what is the surgical removal of the hymen? Hymenectomy. Hymenectomy.
Surgical removal of the bladder.
Surgical removal of the bladder is called what? Cystectomy. So the answer is
B. Surgical removal of the uterus.
uterus.
Number 8. What is the causative agent of chickenpox?
What is the positive agent of chickenpox? What's the positive agent of chickenpox according to you? It is varicella virus. It's which letter?
D.
A is what?
A is paramisopox.
Paramisovirus
Paramisovirus.
causes what? It causes mumps. So don't be confused. It causes mumps. It can also cause measles.
B. Rubella virus.
Rubella virus causes what? It causes rubella virus causes what? It causes German measles. It's German measles. That's all causing the letters.
Influenza virus.
Influenza virus causes what? Influenza. What is influenza? What is influenza? Influenza is simply common cold. When you have catarrh, we call it influenza. So it's being caused by influenza virus.
Number 9. Which one of these is not a complication of diabetes mellitus?
What is diabetes? This is a pathology of which system? You can never leave an examination hall without seeing the equation of endocrine system. Never. Because it is the second leading cause of death in the United States and the world. It is a public health hazard. So according to you, what is diabetes? What is diabetes? You must stop. Tell me what you know. It is high. It is high glucose in blood. Because if we said diabetes is just simply the accumulation of sugar in blood, we call it diabetes. But know that diabetes can be hyperglycemic or hypoglycemic. So what type of hyper it is when it is high, when it is low we call it hypo. So we can say diabetes is a situation where you have increased level of sugar than normal and low level of sugar than normal in blood. Are we there? Because there's a situation that a patient will come to the hospital with high level of sugar, we call it hyperglycemic, and with low level of sugar, we call it hypoglycemic. So diabetes is simply a situation where you experience high level and low level of sugar in blood. So how many types of diabetes do you know? Okay, 2. Name them. Yes. Okay, we have diabetes mellitus. Diabetes mellitus can be type 1 or type 2. Right? Are we there? Please, you should be very attentive. I will show something. The second, we talk of diabetes insipidus. The third, we talk of gestational diabetes. We talk of diabetic ketoacidosis. We talk of HND. Are we there? Good. We're going to start with diabetes mellitus type 1. We already know what diabetes is, right? Diabetes mellitus type 1, because they can ask you receive in your case study, you receive a 22-year-old male at 9 a.m. in the medical surgical unit. He complained of polyphagia, polyuria, polydipsia associated with abdominal pain. What is the diagnosis of that patient? It is is diabetes mellitus type 1. It is diabetes mellitus type 1. So I want to make you to understand, in the talk of type 1, today, type 1, it is from 40 years and below. The age should be from 40 years and below. So when a question like this is being given, first of all look at the age. If the age is between 40 to 40 and above, start thinking of diabetes mellitus type. Another name for diabetes mellitus type 1 is what? Juvenile diabetes. Now, diabetes mellitus type 1 is a situation where there is total destruction of the beta cells of the islet of Langerhans. It is a situation where there is a total destruction of the beta cells of the islet of Langerhans. Langerhans. It is a total destruction of the beta cells of the islet of Langerhans. And diabetes mellitus type 1 is associated with diabetic ketoacidosis. Diabetic ketoacidosis means there is the presence of ketones in blood. That is why the patient will complain of abdominal pain. Ketone acts as an acid, and with the are we there? Now, for children, at the level of the head, it is sharp. At the level of the head for children, this front part like this is 9. Then the other part is, the back side is also 9. Means for children, all of the head is then now for this arm like this, for children, it is the same thing for adult. The problem now comes at the level of the legs. For the level of the legs, we have the front part is 7. The back side is also 7. Are we there? But all of these remain the same, 18. The problem is only at 11. It's 14, please. I'm saying that it is 14. This one is, the front part is 7. The other part is 7. It's 14, not 13.5. It's 14. It's like 14, not 13.5. Now, they can ask you maybe the patient is this the hand, right? Maybe the burn is just here. How can you calculate it? This is a hand, you just have a burn just here. Yes. That. Now, in that case, we use what we call the palm rule, in which one of the rule is 1%. One of the palm is 1%. Is that clear? Are you go there? They are not there. I'm saying that if, okay, for example, this is your hand, and you're having a burn just here, you cannot include all of this because all of this is 4.5. So now we use the palm rule to put here, in which one of the palm is 1%. Have you understood? When the bone is spotted, that's what I'm saying. When it is being spotted, you use the palm rule, in which one of the palm is 1%. Is that clear? Good. Let's go. You have number what? It's also 1%. You have number what, please?
So number 13, the last option is the patient who is running in water.
Yes. The patient who is running in water, what can be the answer? The person who is running answer in water is letter what?
C.
G is what?
So you the patient who was running in water is C, then the patient running in water is C. C is a patient who was running.
Who was running in water?
Running without water.
Without water.
Then
Who was running without water?
No, it's just a patient who was running.
J is a patient who was running.
in water.
Sir,
What is C?
The patient who was running.
Who is running?
The patient
who
was
was?
Who was running?
the patient
Then Z.
who is running
Running in water.
Who is running in water? What's the answer?
Who was?
A patient who was running. A patient who was running is which letter? Yes. Do you know what? Because when you are running, your level of metabolism increases. And you discover that people that swim, they lost a lot of energy. To swim in water is a very tedious sport. It increases your level of metabolism. And when your metabolism is being increased, means it also increases the level of heat. Heat now is going to cause high blood pressure. That's why when you are working in the outpatient department, a patient comes, when you are monitoring the vital sign, ask the patient, were you walking on leg or what? If the patient walking, allow the patient to rest for some time before you monitor the vital signs, because the metabolism must have increased, because as you are moving, heat is being produced in you. When heat is being produced, it also sparks the sympathetic nervous system, which causes high blood pressure. So what is metabolism? It is the sum total of anabolism and catabolism, or the sum total of the building up or the breaking down processes that takes place in the body. That's it. Next.
Number 14. According to Abraham Maslow's hierarchy of needs, which is the most basic human need?
Basic human needs. Please, who can give us, who can draw the pyramids and name what it is there according to Abraham Maslow needs hierarchy of needs? What's the last need? What's the last need according to Abraham Maslow? It is self-actualization. Self-actualization is the last need according to Abraham Maslow. That is why people that are old, some of them are too wicked. Because, I'm telling you, it's very, they are old people that you cannot live with. They are wicked because they never attain the self-actualization stage. That's what I mean is, in life, as you are growing progressively, there are things that you cannot skip. There are things that you cannot skip. If you skip, it's going to hook you at this stage, the self-actualization stage. That is why you still see maybe some mothers around 60 years, they are still rubbing cream. Because when they were growing, they never put that into practice. You see some old fathers, they still put on dinner caps. Instead, they were supposed to be somewhere looking for, taking care of their children. They still put dinner cap moving around because they skip that stage. So what I mean is, in life, if you skip any of these stages, you're going to suffer it at the self-actualization stage. So these parents or these people are very wicked because they know that they never meet up with their target. So they are wicked to everyone. So the first need is what? What do we have? What do we have? The first is yes, the first need under as you are going the pyramid. It is basic physiological needs. Physiological need, you feel it is basic physiological needs. And what are the basic physiological needs? Basic physiological needs. Respiration are basic respiratory needs. Nutrition, basic respiratory needs. Heart rate, basic, etc. Your heart rate, basic physiological needs. Respiratory support, basic respiratory needs. Nutrition, basic respiratory needs. Example. 2, the next is safety and security. 2 is safety and security. Example, protection from injury, promote feeling of security, etc. Ashilo. Ashilo. If I ask you how many of you have taken all the full dose of hepatitis, how many of you, now I'm seeing just 2 people, 3 people, how many of you? Hello? Confirm, how do you?